Why do I have pimples, or why do I have recurrent pimples or acne? Or why is it that for the longest time I've known this person has never ever had a clear skin? If you belong to this category of people, then this video is for you. A lot of times we fail to acknowledge the fact that there are things that can actually cause the pimples or the acne that we have on our skin. What we focus on is just to get products that will clear it, without knowing that most times it stems from inside. What we take in or how we live our lives can contribute to how our skin appears at the end of the day. Also, the kind of skin we have. Of course, we all know that if you have an oily skin, you're prone to pimples and acne. So you just have to find a way to manage it and use products that are meant for your skin in order for you not to clog your pores and also for you not to break out. We understand that. Good. So if you belong to the category of people that are always having issues with their face, from pimples, acne, like different kinds of reactions, rashes, then you have to look out for some things. Number one, puberty, that's your age. We all know that most kids, once they turn 10, 11 to let's say 18, 20, they start having some kind of pimples, acne on their faces. Some people, once they cross 18, after 18 years, they have a clear skin. It all depends on how you handle it. So we have puberty. We also have hormonal changes. Of course, we have hormonal changes. You can have, some people have hormonal imbalance. This can actually affect your skin. It can cause some kind of acne on your skin. Then we have menstrual periods for ladies. Yes, for ladies, some people a week to whenever their menstruation is meant to start, or whenever their period is meant to start, they have breakouts on their face. How you handle it also depends. If you go about popping, you end up with lots of spots on your face and you start treating pimples and spots at the same time. Nobody wants to do that. Then we have things like birth control. If you're on contraceptives, most people, their body react to it, and by the reaction they can end up with big pimples or big acne on their faces. So you see, it's not just your skincare products. Then we have some other medications, some supplements. You can be allergic to some certain things and you won't know until you try them out. That is why during my consultation, I always ask some questions to know what people are allergic to. Some people will tell you, I'm not the skincare type, I'm not the Robin type, I can't tell what I'm allergic to. When you go to hospital, doctors ask you if you're allergic to some certain drugs so that they will know the kind of drugs to administer to you. This also happens when it comes to consultation in skincare. We have to know if what you're allergic to. Some people are allergic to turmeric, some people are allergic to aloe vera, some people are allergic to a lot of things. Okay, then if you have an oily skin, you should be very careful of the kind of moisturizers that you apply or the kind of cleansers that you use, so that it doesn't clog your pores. Because once it clogs your pores, of course it can give rise to a lot of skin issues that you might not be comfortable with. So you have to try as much as possible to avoid heavy lotions and creams. Go for lightweight lotions or moisturizers on your face, and be mindful of how you apply it. Your method of application will also determine if you're going to break out or not. All right. Then also, most people, depending on the kind of clothing, it can also affect them. For some people, personal hygiene as well. You wear makeup as a lady and you think that, oh, because this makeup is too beautiful, I'm not going to wash it off. You're clogging your pores, and of course it's going to react on your skin. All right. So makeup is good, it's perfect, but ensure that you clean very well. Double cleanse if possible, to get rid of all those makeup and allow your skin to breathe. Is very necessary. Ensure that you cleanse your skin or cleanse your face twice in a day, morning and night. Cleanse very well. If you're on makeup, double cleansing is necessary for you to get rid of everything on your face. Also, another thing that can affect is, some people have that family. I don't think I think maybe it has to do with their gene. Some people, their own is genetic, like family, their family is like, let's say, family history. Yes, if some their own is genetic, from their blood, whatever, it affects them. Okay, so if you know it's genetic, then you have to start from time to handle it so that it doesn't affect you or your children. Then sometimes we've talked about personal hygiene, which is very necessary. You have to wash your face twice. Another thing is stress. If you're stressed out, it can also affect your skin and also cause some breakouts on your face as well. Stress has a way of dealing with our skin, but that's one thing we don't know. This is a story, this is like a topic of another thing. Then sun exposure also has a way of dealing with the skin and causing some breakouts as well. We might fail to understand or fail to appreciate it until it happens to us. That is why we have our sunscreens or our sunblock. These are things that you must incorporate in your skincare regimen. I hope I'm making sense. Then choose okay, we've talked about choosing oil, choosing skincare products that are lightweight, that do not have heavy oils. I always emphasize, if you're buying any skincare products, it doesn't have to be organic or natural. Make sure that you read through and note if it's for your skin type. If it's not for your skin type, please keep it. Even if it worked perfectly for your friend or for your loved ones, if it's not for your skin type, discard. Do not buy. Just leave it at the counter and get something else that is suitable for your skin if you don't want to run into problems of trying to treat your face. Okay, most people ask me, okay, what are you using? I have an oily skin, but I've learned how to embrace it. I've learned how to take care of my skin so that I don't break out easily like that. That's just the thing. Know what is suitable for your skin and you do it. Okay, and avoid touching your face. Touching your face a lot can also transmit germs and cause some breakouts as well. Popping the pimples can also cause breakouts on your face, more breakouts, okay, on your face. So we've talked about the factors that can affect or make you have that recurrent acne, that no matter what you do, the acne will also come back. You just have to manage it depending on the category that you fall into. So we've talked about some medications that can cause it. We've talked about, there are some steroids also that can, that steroids are part of medications that by the way, they can also cause it. So know the kind of steroids that you apply on your skin or that you um take as your medication. So we have a lot of things that can actually affect your skin when it comes to acne, or but these are just the few things that we will have to deal on. So at the end of the day, what I would say is, if you have acne prone skin, learn to ask questions or seek for consultation before you get any products. Avoid oils that are heavy. Stop applying shea butter on your skin because someone else with dry skin applied it and the person went scot free. No, know what is suitable for your skin. And for serums, always go for serums that are lightweight. Make sure that you know the kind of serums that you're going for, and make sure you know the kind of moisturizers you're going for. Also, when it comes to between sunblock and sunscreen, go for sunscreens that do not leave white cast on your face, because if you go for the ones that will leave white cast on your face, it will clog your pores, so you end up having to double cleanse every night for you to get rid of all those things and allow your skin to breathe, which sometimes you might not have that time. So do less. Less is more. That's the thing. All right, thank you so much and have a lovely day. This is Linz.